An important aspect of children development, especially in the early childhood, are their rapid neurons carrying multiple messages. Childhood is also the foundation of social psychology. In this video, let's focus on understanding kids as kids, their problem as they leap from toddlers to preschoolers, and finally, I will leave you with some essential understanding about what can you do for your child's mental well-being. So, let's roll. Welcome to Lucid Medicine. I'm Dr. Rahul Joshi and I attempt to explain medical concepts, diseases, medical terminologies in a simple way so that it is understood by you all. So subscribe, like and share to spread health literacy. Understanding your child is one of the most important things that you should learn as a parent. You already know quite a lot of it if you are a teacher, a guide, nurse to these young ones. You need to bear in mind that your child has a unique personality trait that remains consistent throughout the life. According to many child psychiatrists, one of the ways that you can understand your child is by observing them when they sleep, eat, or play. Look for the consistent traits. Which activities do they like the best? Is adjusting to changes easy for them? Or do they need time to become familiar with new things? All of these are normal characteristics of your child, and your child also may not be an exception to all of these. Common problems in preschoolers are attention seeking, disobedience, temper tantrums, breath holding, sleep problems like insomnia, night terrors, feeding problems like food fads, food refusal, eating random things like chalk, soil, dirt, clay, etc. The less common problems include excessive and indiscriminate attachment, especially when they are raised in an institution or foster homes. Poor attachment to the carer. It may be a sign of abuse in the recent past, and most problems mentioned above are short-lived and they should be reported to doctors, and that completely depends on the attitude of the parents as well as on the severity of the issue. So let us look at some of these important issues one by one. First up is the temper tantrums. Temper tantrums are normal from 1 to 3 years of age and are mostly mild in nature, and they also improve with time. Only frequent or severe tantrums are abnormal. For parents and guardians of kids, you need to put in extra efforts, genuine efforts, to understand what exactly is the trigger of the tantrum. Observe on what occasion the child throws up a tantrum. Is it due to frustration or not being able to express themselves or understand themselves, desire of independence, hunger, tiredness, or simply wanting some attention? Tantrums are often provoked by inconsistent disciplinary measures imposed and reinforced unintentionally by giving excessive attention to the child or pampering them when it takes place. What can you do? Temper tantrums usually improve when the parents set consistent limits to the child's behavior. You talk to them politely, make them understand that no means no. Reinforce and enforce these limits kindly but firmly, and pay less attention to the child during the tantrums. Breath holding spells. Period of breath holding can occur in 5% of the kids aged between 2 to 5 years. Breath holding usually occurs when a child is frustrated, upset, or angry. It may begin with a tantrum but for a shorter duration and instantly hold their breath. Children turn blue or purple during they hold their breath and may pass out, that is, they may fall unconscious for a few seconds. This behavior can be alarming to parents, especially if the child loses consciousness. But it is extremely unlikely that the child will be harmed by the episode. What can you do in this? Tell this to your pediatrician or child psychiatrist, understand the nature of the attack, and keep looking for those triggers and avoid it as far as possible. Respond calmly, don't dramatize and make an issue out of it. Look, I'm on your side here, but when you discuss this more and more or make it a big news about it, the kids take it as their achievement, and this positively reinforces their behavior. Managed in this way, the attacks usually disappear. Insomnia or difficulty in falling asleep. Well, I have made a very detailed video on how much sleep do children actually need according to their age groups. Do watch it fully, as I have shared some fantastic workable strategies to help solve this problem. You can find it here in the I button. Pica. Pica is the eating of items that are not food They are very random. So, like I mentioned earlier, chalk, soil, dirt, clay, paint, or even paper. It needs to be differentiated from experimental mouthing of objects, which happens usually in the age group of 1 to 2 years. Pica is often associated with other behavioral problems like autism or learning disabilities. What can you do? First of all, stop worrying and be relieved by the fact that the problem is recognized disorder, which usually improves. Meanwhile, take commonsensical measures to keep the child away from such non-edible items and reduce such stressful situations. With this approach, the problem usually disappears. If it does not, there may be another issue which requires a specialist assessment. Childhood behavioral and mental issues can be treated and managed. There are many treatment options based on the most current medical evidence. Parents and teachers should work closely with one another involved in the child's treatment, and teachers, coaches, therapists, and many other family members, not just the ones which I have listed. This approach proves to be effective in guiding and nurturing your child as they grow and mature. Time to end the video. Thanks for watching Lucid Medicine, reimagining medicine in a simpler way.